This is the Astral Radio Network and the Dr. Don Show. It's your health, it's your life. Now, back to the show. Here's Dr. Don.
Welcome back, listeners. I'm Dr. Don Nixdorf, chiropractor these past 40 years, executive director for the BC Chiropractic Association and College of Chiropractors. This is, I think, our third episode relating to spine-related injuries, and specifically looking at the relationship of acquired brain injuries and some of the symptoms. The problem with many of these cases, of course, is that these things heal slowly. Brain amongst the other nerve tissue is very, very slow to heal, and quite often what can happen at a clinical level, the patient is being cared for. The treatments that any practitioner is giving are having slow or marginal results, and we need to be more alert to finding out why that may happen, particularly in the case of brain injury. Our next guest, brain injury. In May 2007, when a serious car crash nearly ended her life, Colleen Butler realized that there was very little help available in the medical profession or in the system for individuals suffering from brain injuries. Colleen stepped away from her 25-year career as an entrepreneur and businesswoman in order to focus on developing a roadmap to recovery from brain injury. She is an accomplished author, international speaker, and lifestyle coach, and devotes much of her time to Brain Navigators, a one-on-one coaching program that supports injury patients through a holistic approach. Welcome to the show, Colleen.
Thank you, Dr. Don.
Colleen, we like to bring people like you to the program because there are many conditions that people suffer from that are chronic, and some of the people that are experiencing these chronic problems, whether it's the brain injury that you had and others, they become advocates. They become the doctor. They become the person who really becomes knowledgeable about their condition and how to treat it. And this is really your story as well.
Yes.
So to recap, what happened to you?
Well, I was hit by another vehicle, and I was thrown about 200 feet down the road. I didn't hear it coming. I didn't see it coming. The only thing I recall is I couldn't put my foot on the brake. And my neck snapped. There was no big bruise. There was no blood gushing from my head. I was able to walk away. And because I walked away and I wasn't knocked out, I was severely dismissed. I was told I might have some soft tissue damage, maybe.
Popular story. Thought everything's soft tissue.
Everything's soft tissue.
Now, you say you were not knocked out.
Well, that's what I thought until just a few months ago, actually, and I realized all I remembered was not putting my foot on the brake. So although I said that same sequence of events, nobody picked up on it. I just picked up on it myself like 2 months ago, which I'm embarrassed to say.
So after the injury, after the crash, and let's point out, Colleen has written a book. It's called Concussion Recovery. So if you're listening to us, you can always go to your computer as well, or if you're listening to us on your computer can multitask, even if sometimes we can't. So I'd invite you to go to Colleen's website, www.brainnavigators.com, brainnavigators.com. And if you have any questions for Colleen, if you know somebody or if you yourself have acquired a brain injury or you think you have brain injury symptoms that are undiagnosed, Colleen is one of these people who has had the experience. She's gone around the process. She's written a book on how to recover from concussion. And it is a process. In the Vancouver area, call us 604-280-0650. Long distance, it's toll-free out of town, 1-877-280-0650. And of course, remember, if you don't want to call us, if you're a little hesitant, give us an email, radio, R-A-D-I-O, radio@bcchiro.com. Colleen, the event was in 2007.
Yes.
How long did you go before you started to sort of make sense of what was going on?
Well, as I walked away, and it was very much what Michael Freeman was talking about, was that fluid getting to my brain. It just was not getting there. So essentially I was getting less and less astute with anything. So the whole process of at the moment that I found out that it was a brain injury, it was actually from my chiropractor, and he sort of started leading me away. So then I became more resourceful in starting to look and seek out and look for things. But the healing time, everybody's is 100% different. It's all the velocity and the direction of the hit, as in the time for recovery, unfortunately.
Well, you mentioned a couple of important things. Let me deal with the easy one first. your family chiropractor started to assess some of your symptoms, and what did they say? They outright said, I think you've had a brain injury, or did they refer you, or what was the process there?
No, he was pretty certain I was, because he had done enough tests and scans on my back to realize how far that I was knocked out, that I was out of alignment. And so it was obvious there was no pinch, like my whole back of my neck was all pinched.
So you were experiencing problems in the neck area.
In the neck, my whole back just hurt. I mean, when you get hit with such an impact that it destroys your vehicle and you walk away fine.
So your vehicle was destroyed as well?
Oh, yeah. Yeah, it was totaled.
And the first response was it's just soft tissue?
Oh, yes.
Not by your chiropractor?
No, that was by the medical doctors.
Sure. Okay. Well, so when you started to have the treatment of the neck area, how did you start to, what were some of the symptoms that you began to change?
It was working with the chiropractor allowed me to do something during the day. He actually gave me my mobility. He gave me my mobility, and knowing that I wasn't going crazy probably was the two best assets that he was able to get me going so that I could start flowing. And of course, as the fluid is making it to my brain and the messages are coming up and down my spinal cord, then that made that much easier that I was going to start on the road of recovery.
Now, you didn't hit your head, or did you hit your head in the car crash?
No, there was no hit, just a very large snap in the back of my neck.
You heard that part?
Oh, yes.
Okay. And after the car crash, the car was totaled. Were you taken to hospital?
No, I didn't have time to be sick. I had to get back to my job site. So it was just like go, go, go. Like, I guess the adrenaline was running pretty high at the time.
Oh, very much so. Well, I'm a little bit confused and concerned. Your car was, obviously damaged badly. It turns out it was written off, as it were, or did they repair it?
Oh, no.
So,
he said a half an inch either way and I would have been road rash.
So I'm a little confused as why someone didn't want to say, look, I know you're walking, you seem a little disoriented, I think we should take you at least for observation. That didn't happen.
No. And I, Dr. Don, am not alone. This has happened many, many, many places right across the board. The misdiagnosis of the brain injury is absolutely horrendous. And the sob stories, they're not sob stories, the true fact of what happens when they are misdiagnosed is absolutely devastating.
So how long did you suffer before, or experience the symptoms before you started to get some more mechanical mobility? Your neck started to move a bit better, your body started to move a bit better, you could function better. How long did that take after the car crash? 6 months, a year, or how long was it?
It took me 3 years to have the pain leave my body.
3 years.
3 years for the pain to leave my body, but for regular coming back and forth to the chiropractor, that lessened with time.
Now, you did other things as well to try to recover, because I read your book through here, and your whole journey of recovery is multifaceted. There are so many things that were in a process of recovering from the effects of the brain injury that there really isn't any one practitioner of any kind that would deliver or could deliver all these things. So you really became your own doctor for your own recovery.
Yes, and that was 100% out of necessity. And, if we think about all the different things that our brain does, it isn't just mechanical, it isn't just emotional. And so it's not like any other part of our body which breaks, which case we can stitch it up and patch it and put a cast on it and then we're fine. It's too many different things. So we have to be extraordinarily resourceful using sort of Eastern and Western medicines to give us a solution, because it definitely, to be in a position with a brain injury without services is an awful, very ugly place to be.
Well, I had a call about a couple of weeks ago, and this person also was in a car crash a year ago, was experiencing brain-related symptoms, and found that because they were seeking help, but the help was 6 months after the event, she was experiencing reluctance in the people in the system to give her help for brain injury.
Oh, most definitely. That happened to me. My local doctor told me to go to UBC in the walk-in clinic and they'd help me, and I went there. They just sort of, well, I won't say they laughed at me, but I was discarded because it had been too long afterwards, and that is a very big issue.
How did your friends and family react, or what comments did they make to you? I mean, people could see you on a daily basis functioning. What was the comment and support like from them?
I think people were really surprised that there was anything wrong with me because I was so capable and I looked just fine. So therefore I should be fine and I should be able to do the things prior to the accident. And so it's this whole stigma because I didn't really understand everything that was going wrong with me. So how could anybody else around me understand? So it's a very lonely place, and you also hide it because there's a mental part that goes with it. Because my brain was shooken, so it hit the front of my front lobes were hit, and then the brain sort of in that fluid swooshed back to the back of my skull. It was the front part that was damaged.
It's that traditional word whiplash, where the movements of the body occur in a manner that is rarely found in some other circumstance. We see it now in some of the sports events that are starting to come to light, but it's a common event since the train and the car were developed.
Well, that's right. You look at your skull, and that's where you're actually the bruising of the brain happens. Is your brain hitting the inside of the skull? And that's what we don't think because the skull's not cracked open. If your skull's cracked open,
Right.
you get lots of attention.
Well, you mentioned something about loneliness, and I think that's sort of a striking thing that sort of becomes a real difficulty, I imagine, for people to cope with, because there's a problem in healthcare. It's not anybody's problem particularly, but unless there's something bleeding, broken, swollen, a bone sticking through the skin, there tends to be a sort of a bias right now that, gee, this patient, what's the matter with this patient? So we sometimes default inappropriately to just visually looking at the patient. Well, there's nothing bleeding, there's no bone sticking through the skin. What's the problem here? So communicating some of this brain injury information is a bit challenging, I take it.
It is really challenging. And I think that most of the medical part, they're cut, remove, and prescribe. And so anything that's a little bit off the box or out of the box, they don't know what to do with you. And when you have the crazy thoughts going in your mind, which does happen because your brain's being scrambled, you're not psychotic. You're temporarily mixed up, yes, but it does come back, and there is hope for coming back.
We're speaking with Colleen Butler. She's the author of Concussion Recovery. You can go right now to the computer and check this out. It's www.brainnavigators.com. If you yourself have experienced an injury and you're unsure of what some of your symptoms are, or you've been told that you're suffering from brain injury effect, this is a resource you definitely want to check out, because ultimately you're going to be the doctor that makes yourself better. Now, in addition, it's halfway through the program, so that means it's time for all of the lovely listeners to sit up, stand up, and get up. Get out of that chair, because this is where we ask you to do these 2 seconds or 2 minutes of stretching exercises. That's right. You stand up, you bend all the way to the left, all the way to the right, forwards, not too far backwards, and of course fully turn left and right. So while you're doing that 5 to 10 times in each direction, it's all about your health. You're listening to the Dr. Don Show live on AM 650.
The Dr. Don Show. It's your health, it's your life. On the Astral Radio Network. There's still lots more ahead.